Welcome to our exploration of predictive models in healthcare. In recent years, the integration of advanced data analytics and machine learning has revolutionized the way medical professionals approach patient care. Predictive models use historical and real-time data to forecast health outcomes, enabling earlier interventions and more personalized treatment plans. This technology is not just a futuristic concept, it's already making a significant impact in hospitals and clinics around the world. In this video, we'll uncover how predictive models work, their applications, and the benefits they bring to both patients and providers. Let's begin by understanding what predictive models are and why they matter. Predictive models are mathematical tools that analyze patterns in data to make informed predictions about future events. In healthcare, these models process vast amounts of patient information, such as medical histories, lab results, and even genetic data. By identifying trends and correlations, predictive models can estimate the likelihood of various health outcomes, such as disease progression or hospital readmission. This approach allows healthcare professionals to move from reactive to proactive care, anticipating problems before they arise. Understanding the basics of predictive modeling is essential for appreciating its transformative potential in medicine. Data is the lifeblood of predictive models. Every patient interaction, test result, and treatment outcome generates valuable information. When this data is collected and organized, it forms the foundation for building accurate predictive models. High-quality, comprehensive datasets allow algorithms to learn from past cases and make reliable forecasts. However, the process also requires careful attention to data privacy and security, ensuring that sensitive health information is protected at all times. The more robust and diverse the data, the more powerful and precise predictive models become. Machine learning is a key technology behind predictive models in healthcare. These algorithms can process massive datasets, uncover hidden patterns, and continuously improve their predictions as new data becomes available. For example, machine learning models can analyze thousands of medical images to detect early signs of disease or predict patient deterioration in real time. By learning from both successes and failures, these systems become more accurate over time, supporting clinicians in making better decisions and improving patient outcomes. One of the most promising uses of predictive models is in early disease detection. By analyzing patient data, these models can identify subtle warning signs that might be missed by traditional methods. For instance, predictive algorithms can flag patients at risk for conditions like sepsis, heart disease, or cancer, prompting timely interventions. Early detection not only improves survival rates, but also reduces the cost and complexity of treatment. This proactive approach is transforming how healthcare systems manage chronic and acute illnesses. Hospital readmissions are a major concern for both patients and healthcare providers. Predictive models can analyze factors such as patient demographics, medical history, and recent treatments to estimate the risk of readmission. By identifying high-risk individuals, care teams can implement targeted interventions such as follow-up appointments or home health visits to prevent unnecessary returns to the hospital. This not only enhances patient well-being but also helps hospitals manage resources more efficiently and reduce costs. Predictive models enable truly personalized medicine by tailoring treatment plans to each patient's unique characteristics. By considering factors like genetics, lifestyle, and previous responses to therapy, these models help clinicians choose the most effective interventions. This approach minimizes trial and error, reduces side effects, and increases the likelihood of successful outcomes. Personalized treatment is especially valuable in complex fields like oncology, where every patient's journey is different. Healthcare systems often face challenges in allocating resources such as staff, beds, and equipment. Predictive models can forecast patient volumes, seasonal trends, and potential surges in demand. This information allows administrators to plan ahead, ensuring that resources are available when and where they are needed most. Efficient resource allocation not only improves patient care, but also reduces waste and operational costs, making healthcare delivery more sustainable. Managing chronic diseases like diabetes, heart failure, and asthma requires ongoing monitoring and timely interventions. Predictive models can identify patients at risk of complications, enabling care teams to intervene before problems escalate. By analyzing trends in symptoms, medication adherence, and lifestyle factors, these models support proactive care and help patients maintain better control over their health. This leads to fewer hospitalizations and improved quality of life for those living with chronic conditions. Emergency situations, every second counts. Predictive models can help emergency departments anticipate patient influxes, prioritize cases, and allocate resources more effectively. By analyzing historical data and real-time inputs, these models support faster triage and better coordination among medical teams. This leads to quicker response times, improved patient outcomes, and more efficient use of emergency services. Diagnostic errors can have serious consequences for patients. Predictive models assist clinicians by providing evidence-based recommendations and highlighting potential risks that might otherwise go unnoticed. By combining data from multiple sources, these models help reduce human error and ensure that diagnoses are as accurate as possible. This not only improves patient safety, but also builds trust in the healthcare system. Beyond individual care, predictive models play a crucial role in managing the health of entire populations. By analyzing trends across large groups, healthcare organizations can identify at-risk communities, track disease outbreaks, and design targeted public health interventions. This population-level insight enables more effective prevention strategies and helps allocate resources where they are needed most, ultimately improving health outcomes on a larger scale. Mental health care is another area benefiting from predictive modeling. By analyzing patterns in behavior, medication use, and even social media activity, predictive models can identify individuals at risk of mental health crises. Early identification allows for timely support and intervention, reducing the risk of hospitalization or self-harm. These tools are helping to break down barriers to mental health care and provide more proactive, personalized support. Integration of genomics with predictive modeling is paving the way for precision medicine. By analyzing genetic data alongside clinical information, predictive models can forecast disease risk and guide personalized treatment options. This approach is especially valuable in fields like oncology and rare diseases, where genetic factors play a significant role. Precision medicine promises more effective therapies and better outcomes for patients with complex health needs. Remote monitoring devices and telehealth platforms are generating vast amounts of real-time health data. Predictive models can analyze this information to detect early signs of deterioration, alert care teams, and recommend interventions. This technology is especially valuable for patients with chronic conditions or those living in remote areas, as it enables continuous care without frequent hospital visits. Telehealth combined with predictive analytics is making healthcare more accessible and responsive. Medication adherence is a common challenge in healthcare. Predictive models can identify patients who are at risk of missing doses or discontinuing treatment. By analyzing factors such as prescription refill patterns and patient behavior, care teams can intervene with reminders, education, or support. Improved adherence leads to better health outcomes and reduces the risk of complications, especially for those managing chronic illnesses. Healthcare fraud is a significant issue, costing billions each year. Predictive models can analyze billing patterns, provider behavior, and claim histories to detect unusual activity that may indicate fraud. By flagging suspicious cases for further review, these models help protect healthcare systems from financial losses and ensure that resources are used appropriately. This technology supports the integrity and sustainability of healthcare delivery. Efficient supply chain management is critical for healthcare organizations. Predictive models can forecast demand for medications, equipment, and other supplies, helping to prevent shortages or overstocking. By analyzing historical usage patterns and external factors, these models support better inventory planning and cost control. This ensures that essential resources are always available to support patient care. Engaged patients are more likely to achieve positive health outcomes. Predictive models can identify individuals who may benefit from additional education or support, tailoring communication to their needs and preferences. By delivering timely information and resources, healthcare providers can empower patients to take an active role in their care. This leads to better adherence, improved satisfaction, and healthier communities. Predictive models are invaluable tools for tracking and forecasting infectious disease outbreaks. By analyzing data from multiple sources, including hospitals, laboratories, and even social media, these models can detect early signs of emerging threats. This enables public health officials to respond quickly, implement containment measures, and allocate resources effectively. Predictive analytics played a crucial role during the COVID-19 pandemic and will continue to be essential in future public health emergencies. Surgical procedures carry inherent risks, but predictive models can help minimize complications. By analyzing patient data, surgical history, and risk factors, these models estimate the likelihood of adverse events and guide preoperative planning. Surgeons can use this information to tailor their approach, optimize patient preparation, and reduce the risk of postoperative complications. This leads to safer surgeries and better recovery experiences for patients. Clinical trials are essential for developing new treatments, but they can be time-consuming and expensive. Predictive models can identify suitable candidates, forecast enrollment rates, and monitor patient responses in real time. This streamlines the trial process, reduces costs, and accelerates the development of innovative therapies. By making clinical trials more efficient, predictive analytics helps bring new treatments to patients faster. Preventive care is a cornerstone of modern healthcare. Predictive models can identify individuals at risk for preventable conditions, such as diabetes or hypertension, and recommend targeted interventions. By focusing on prevention, healthcare providers can reduce the incidence of chronic diseases, lower healthcare costs, and improve overall population health. Predictive analytics empowers both patients and providers to take proactive steps toward wellness. Patient safety is a top priority in healthcare. Predictive models can identify potential safety risks, such as medication errors or hospital-acquired infections, before they occur. By alerting care teams to these risks, predictive analytics enables timely interventions that protect patients from harm. This proactive approach fosters a culture of safety and continuous improvement within healthcare organizations. Healthcare costs are a major concern for patients, providers, and policymakers. Predictive models help reduce expenses by optimizing resource use, preventing unnecessary procedures, and minimizing complications. By enabling earlier interventions and more efficient care delivery, predictive analytics supports the financial sustainability of healthcare systems. The result is better value for patients and improved outcomes for everyone involved. With great power comes great responsibility. The use of predictive models in healthcare raises important ethical questions, such as data privacy, algorithmic bias, and informed consent. It's essential for healthcare organizations to ensure that predictive analytics is used transparently and fairly, with safeguards to protect patient rights. Ongoing oversight and collaboration between clinicians, data scientists, and ethicists are crucial for building trust and maximizing the benefits of this technology. Despite their promise, predictive models face several challenges in real-world healthcare settings. These include data quality issues, integration with existing systems, and resistance to change among staff. Overcoming these barriers requires investment in technology, training, and change management. By addressing these challenges head-on, healthcare organizations can unlock the full potential of predictive analytics and drive meaningful improvements in care. Successful implementation of predictive models depends on collaboration between clinicians, data scientists, IT professionals, and administrators. Each group brings unique expertise to the table, ensuring that models are clinically relevant, technically robust, and aligned with organizational goals. Open communication and teamwork are essential for translating predictive insights into real-world improvements in patient care. Predictive models are not static, they require ongoing evaluation and refinement. As new data becomes available and healthcare practices evolve, models must be updated to maintain accuracy and relevance. Continuous monitoring, validation, and feedback from clinicians help ensure that predictive analytics remains a valuable tool for improving patient outcomes. This commitment to quality drives long-term success. For predictive models to be effective, healthcare professionals must understand how to use them. Ongoing training and education are essential for building confidence and competence in predictive analytics. By equipping staff with the knowledge and skills they need, organizations can maximize the impact of these powerful tools and ensure that patients receive the best possible care. Building trust with patients is vital when using predictive models. Transparency about how data is used, how predictions are made, and how decisions impact care helps foster confidence in these technologies. Open communication ensures that patients feel informed and involved in their healthcare journey, strengthening the patient-provider relationship. Seamless integration with electronic health records (EHRs) is crucial for the success of predictive models. By embedding predictive analytics into EHR systems, clinicians can access real-time insights at the point of care. This integration streamlines workflows, reduces administrative burden, and ensures that predictive tools are used consistently and effectively. Mobile health apps and wearable devices are generating new streams of health data. Predictive models can analyze this information to monitor patient health, detect early warning signs, and recommend interventions. These technologies empower patients to take control of their health and enable providers to deliver more personalized, data-driven care. Artificial intelligence, AI, and deep learning are advancing predictive modeling to new heights. These technologies can process complex datasets, recognize subtle patterns, and generate highly accurate predictions. In healthcare, AI-driven models are being used for everything from image analysis to natural language processing, opening up new possibilities for diagnosis, treatment, and research. Natural language processing (NLP) is a branch of AI that enables computers to understand and interpret human language. In healthcare, NLP can extract valuable insights from unstructured data such as clinical notes and patient narratives. By incorporating this information into predictive models, healthcare providers gain a more comprehensive view of patient health and can make better-informed decisions. Real-time analytics is transforming the way healthcare providers respond to patient needs. Predictive models that process data in real time can alert clinicians to changes in patient status, enabling immediate interventions. This capability is especially valuable in critical care settings, where rapid response can make the difference between life and death. Protecting patient data is paramount in predictive modeling. Robust security measures such as encryption and access controls are essential for safeguarding sensitive information. Healthcare organizations must comply with regulations and best practices to ensure that patient privacy is never compromised. Trust in predictive analytics depends on a strong foundation of data security. Interoperability, the ability of different systems to work together, is a major challenge in healthcare. Predictive models rely on data from multiple sources, but integrating these systems can be complex. Overcoming interoperability barriers requires standardized data formats, open communication, and collaboration across organizations. Achieving true interoperability unlocks the full potential of predictive analytics. Regulatory oversight is essential for ensuring the safe and effective use of predictive models in healthcare. Agencies such as the FDA provide guidelines for the development, validation, and deployment of predictive analytics tools. Compliance with these regulations protects patients and supports the responsible adoption of new technologies. Future of predictive models in healthcare is bright. Advances in AI, data science, and digital health are driving new innovations, from personalized medicine to population health management. As technology evolves, predictive analytics will become even more integral to patient care, enabling earlier interventions, better outcomes, and more efficient healthcare systems. Let's look at a real-world example: sepsis prediction. Sepsis is a life-threatening condition that requires rapid intervention. Predictive models analyze patient data, such as vital signs and lab results, to identify early signs of sepsis. By alerting clinicians before symptoms become severe, these models enable timely treatment and improve survival rates. This case study highlights the life-saving potential of predictive analytics in critical care. Another example is heart failure management. Predictive models can identify patients at risk of hospitalization by analyzing trends in weight, symptoms, and medication adherence. Care teams can then intervene with tailored support, such as medication adjustments or home visits, to prevent hospitalizations and improve patient quality of life. This proactive approach demonstrates the practical benefits of predictive analytics in chronic disease management. Oncology, predictive models are used to forecast treatment responses and side effects. By analyzing genetic, clinical, and lifestyle data, these models help oncologists select the most effective therapies for each patient. This personalized approach reduces unnecessary treatments, minimizes side effects, and increases the likelihood of successful outcomes. Predictive analytics is transforming cancer care for the better. During the COVID-19 pandemic, predictive models played a vital role in tracking the spread of the virus, forecasting hospital demand, and guiding public health responses. By analyzing data from multiple sources, these models enabled healthcare systems to allocate resources, plan interventions, and save lives. The pandemic underscored the importance of predictive analytics in managing large-scale health crises. Predictive models are reshaping the future of healthcare, offering new ways to improve patient outcomes, optimize resources, and deliver personalized care. As technology continues to advance, the potential for predictive analytics will only grow. By embracing these tools and addressing challenges along the way, healthcare organizations can build a smarter, more responsive, and more compassionate system for everyone. Thank you for joining us on this journey into the world of predictive models in healthcare.